you. Question 2, Neil Hamilton.
What discussions has the First Minister had in order to improve hospital waiting times?
NHS performance, including hospital waiting times, forms part of my regular meetings with the Minister of Health and Social Services.
I thank the First Minister for that reply. Is the First Minister aware that in the period of July to December 2018, ambulances were waiting outside hospitals in Abergavenny and in Newport for over 5,000 hours, and therefore they couldn't respond to emergencies? Given that the average ambulance crew is 2 on these occasions, that's 10,000 crew hours which have been lost. The handover time target in these cases is 15 minutes, but as regards the Royal Gwent Hospital, that target is only met for half the time. Now, these figures were revealed in answers to a Freedom for Information request by a Mr Eddie Blanche, who said, because he had seen ambulances served by welfare vans outside the hospital to supply waiting crews with hot drinks and toilets because they were expected to wait there for such a long time. He said, if it's bad enough they have to give them a bus to have their rest in whilst waiting to unload patients, then this is an issue that needs to be addressed now. He says, it's scary. I'm worried that people will start dying if the problem isn't fixed. When does the First Minister think the problem will be fixed?
Well, the figures that the member quotes are freely available. They don't need to be got through a Freedom of Information request because we make that information available in the public domain all the time. Of course, ambulance handover figures are a concern to us because they reflect pressures in the system as a whole. Over this winter, we know that handover times have improved rather than got more difficult. We know that since we moved to a different way of measuring the success of the ambulance service, we have been able to demonstrate that those patients who need that service most urgently get it most quickly and effectively all across Wales, and strenuous efforts go on through the ambulance service, through emergency departments, through the people who work in that service to go on improving what we are able to offer, and those efforts will continue into this year.